In this video, I'm going to discuss the new 2021 Medicare supplement trend, why this is beneficial to you, and how you can potentially take advantage of this opportunity. Hi, if we haven't met already, my name is Michael Hitcho. I'm the owner of Hitcho Insurance, which I started in Bethlehem, Pennsylvania in 2004 with a focus on serving residents in the eastern area of Pennsylvania. I currently work and serve folks in Pennsylvania and New Jersey for their Medicare insurance needs, and to date have helped thousands of individuals just like yourself get the coverage they need by taking the time to understand your situation based on your medications, the doctors you see, your finances, your healthcare needs, and even your personality. But regardless of what state you currently live in, this video can help educate you on this emerging trend and show you steps on how you can take advantage of this opportunity. So, what's the trend in 2021 with Medicare supplements? Well, in 2020, we saw the elimination of sales of Medicare supplements plan F and C to new Medicare beneficiaries. Because of this, only folks who were on Medicare Part A prior to 2020 are eligible to purchase Plan F or C for their first time frame or move between carriers for the same plans as long as they can pass medical underwriting. I'll talk a little bit more about medical underwriting shortly. Since new to Medicare beneficiaries can't purchase plans F and C, which, by the way, were considered to be the best supplement plans since they cover all of Medicare Part A and Part B's deductibles, co-payments, and co-insurance, folks are now turning towards Plan G. Let's take a quick moment and compare plans F and C and G. As I mentioned before, Plan F and C covered Medicare's deductibles, their co-payments, and their co-insurance that are left behind. Well, it turns out that Plan G does just about the same thing. It covers all of Medicare Part A's deductibles, co-payments, and co-insurance. What it doesn't cover, meaning you'll be responsible for payment on, is the Medicare Part B deductible. Now, the deductible amount listed in this video is for this year. It's roughly around $200. Once you pay that deductible, Plan G will pick up the remaining 20% of charges that are left behind by Medicare, since they only cover 80%. If you've been on Medicare and have Plan F or C, you might be asking yourself, how is this beneficial to me? I have the best coverage. I could keep that coverage. Why change? All this information seems like it's only geared towards new Medicare beneficiaries, but it's not. Let's take a look at a few facts, some of which I'll explain using a case scenario. Let's talk current rates. For a female age 68 living in Allentown, Pennsylvania, one of the lowest costing Plan F policies from one of the largest insurance carriers is going to cost her $135 a month. Remember, Plan F covers all the deductibles, co-payments, and co-insurance left behind by Medicare Part A and Part B. Plan G will cost that same person only $102 a month. Now, that's a difference of $33 each month, which is nearly $400 a year. The only expense that she would incur by having Plan G versus Plan F is the Medicare Part B deductible, which is around $200. Her true savings then would be around $200 for the year. Now, that may sound like a lot or not a lot to you, but times that by 10 years, and we're talking over $2,000 in savings. Let's talk future rates. What you don't see is inflation. It's hidden and often overlooked. If her Plan F increases by 10% a year, in year one, her rate increase will be $13.50. If the same increase takes place on Plan G, her rate increase is only $10.20, which is a difference of $3.30 a year or another $40. Because of this inflation increase, her savings in year two is closer to $240, but in year three now $280. See how it keeps going up in larger amounts over time? Why is this important? Because you could be on Medicare and a Medicare supplement plan for decades. So we could be talking tens of thousands of dollars. Lastly, talking about future rates, let's consider the fact that more people are going to be purchasing Plan G and less will be staying on Plan F and C over time. The folks who stay on plans F and C will potentially have higher rate increases to make up for the cost of the rest of the insureds who cannot make a policy change. So, how do you take advantage of this opportunity? I think there are two important things to understand. One, you can change your Medicare supplement plan anytime throughout the year as long as you can pass the medical questions of the new insurance carrier. There's no medical exam, simply medical questions. Now, Medicare makes this process very, very easy. They do that because all the Medicare supplements are standardized plans. So it's not the insurance carrier that dictates coverage, it's the letter of the plan that you're enrolling and purchasing that dictates it. So as long as you can pass those medical questions, all pre-existing conditions will be covered. And I'm not talking about those PPO or those HMO Medicare Advantage plans. There's no need to see if your doctor accepts the new insurance carrier. You'll still stay on original Medicare as your primary insurance plan. The supplement's just designed to pick up the co-payments and deductibles left behind by Medicare. Now, number two, since there are so many options available to you, I would recommend working with an unbiased Medicare insurance broker. Someone who's contracted with several major insurance carriers and has a fair understanding of not only Medicare supplements, but Part D prescription drug plans and Part C Medicare Advantage plans as well. You should get an education, not a sales pitch. That's why I only choose to service Pennsylvania and New Jersey, because there's no way that one person can be an expert in so many different markets throughout the whole entire United States of America. Thank you for taking the time to watch my video. I truly hope that you're able to save some money as a result of it. I'm sure you know a lot of different ways that you could spend or save your money instead of turning it over to an insurance company. Take a look at some of my other videos on my YouTube channel, Hit Show Insurance. Thank you so much and have a great day.